So there I was, November last year, early in the morning, walking along this stunning beach, Gold Coast, Queensland. It was the day before I was due to go into the jungle, and I'm wandering along the beach thinking maybe I need to have my bumps felt for going on to this programme. And there was a chap there fishing, and I had a hat on and wraparound glasses and thought nobody would recognise me, and he called my name, and I went to have a chat with him, and he was from Cheshire. He was there with his dad. And I said, what are you up to? Oh, he said, I've just become an orthopaedic surgeon, and we've moved to Brisbane. And his dad said, yeah, cost us a blooming fortune to train him, and the first thing he does is disappear. Well, good luck to the youngster. I love Queensland. I could move to Brisbane tomorrow. But it struck me that we are spending a heck of a lot of money training doctors. Now, for example, when you get to a level of a consultant, the estimate is that over £400,000 of taxpayers' money has been spent getting that man or woman to consultant level. And I think we should return to an idea that was rather well known in Dickens's day. It was called indenture. What it meant, it was a contract. We will train you, we will invest our time in you, we will invest our money in you, but you've got to give us back a number of years' service before you consider going to Australia or elsewhere. And I know some people are going to think I'm being terribly old-fashioned, but I do think that it's wrong that we train doctors that head off around the world. We then import doctors from poor African countries that probably need those doctors more than we do. As you can see, I feel quite strongly about this. Now I'm joined by Dr. Tolyu, an NHS doctor who joins me down the line, who I understand has just flown into Manchester from Australia. Are you about to desert us?
Well, I mean, it's very tempting.
Well, I tell you what, it is very tempting because just looking at the numbers, a GP in the UK's average hourly wage is about £33, but in Australia it's about £64 and property's half the price. So it's double the money, the weather's better, houses are cheap. I mean, I get it. Is that what's tempting you?
I mean, I wouldn't say it's more about the money. I mean, I'd say it's more about, kind of how the healthcare system, treats its, healthcare workers. I think, obviously, we're currently in the middle of a strike at the moment. That's just, a perfect example of, what the NHS is like at the moment. It's overstretched. Doctors don't feel like they're valued. Doctors are, underpaid, overworked. Kind of all of these things put together does make that, very nice weather look a lot more appealing.
No, I get the morale point. But just to take my point, if I may, that when you've gone all the way through to become a consultant and you're earning really very big money, isn't it reasonable for people who watch or listen to this programme, who pay their taxes to train people, isn't it reasonable to expect a few years of service back?
I mean, it takes quite a few years to get there, in the first place. Yep. I mean, as you can imagine, obviously there are, medical school fees, and then you've got your insurance, there are, going through med school isn't exactly a walk in the park, as you can imagine. And I do understand where you're coming from in terms of, having, a level of service after you have graduated. I mean, that technically does exist. Now, you've got your foundation year 1, your foundation year 2, which most people do stay for. And then obviously most people at that point do stay in the UK. Because at that point, you've got
but there's no compulsion, is there?
Well, no compulsion. But I feel like a lot of people who do go into, medicine do really care about the NHS. You spend all those years training in the NHS, and you feel, a sense of you have to give back, a sense of, I've been in the NHS for about 3-4 years now, and it's only at that point I even started thinking about Australia,
All right. No, fair point. And you've made the point about morale very, very strongly. So, Dr. Tolyu, the next time I walk down that beach on Gold Coast, Queensland, will I see you there fishing?
Oh, well, you never know.
I'm going to take that as a yes. I'm going to take that as a yes. Thank you very much indeed. Now, Dr. Emeka, NHS A&E doctor and author of Your Health in Your Hands, joins me. You heard that debate. You heard that conversation. I mean, is morale that bad?
Honestly, so because of technical issues, I don't have an earpiece, so I can actually hear what
I'm sorry.
he was saying.
What he was saying was that morale is not good.
Right.
That junior doctors are not being treated very well. That's why the strikes have happened.
Yes.
And that actually double the pay and sunshine in Australia is quite tempting.
It is tempting. I can understand from Dr. Toller's point, especially a number of my friends and different colleagues have gone not just to Australia, but to Canada, to the States, to the Middle East. And you can see why. Obviously, I've trained here in the NHS. I went to medical school here, and I'm working in the NHS, and I enjoy it. However, I do see what they're talking about in terms of morale. Doctors here feel undervalued. They feel underpaid, and they feel overworked.
But they've always been some of the most respected members of our communities.
You say that, but then it's not reflected in the pay restoration that doctors have been fighting for, and they just don't feel like the government is actually doing its bit to value these doctors. So, for example, Nigel, if I told you could do the exact same job in somewhere else, in a better place, you get paid more, you're more respected, and you have a better quality of life, you'd think about leaving too.
And it is literally, for doctors and nurses, Australia and New Zealand double the money.
Yeah, as I know they spoke to an emergency medical consultant who'd gone out there in 2017, and he's earning 3 times what he'd be earning here in the NHS. So it does make sense from that point of view.
From their point of view,
I do get the.
What about the poor old taxpayer?
Yes, I do get the view of obviously retaining doctors, but you need to start with like the smaller things of having doctors feel like they're valued in the community, as in the workforce. The management needs to change. And I think I've actually spoken to some of the people higher up in terms of management and the Prime Minister at Downing Street, where we were discussing what could be done over 10 years to retain doctors. So they're obviously trying to recruit more and train more, increase medical school places, which is great. But you're going to be losing doctors
as long as
year.
they stay. But it's not great if we invest loads of public money. They go off and work somewhere else. I believe there should be a contract that makes them stay for at least 5 years or something. I mean, that's what I believe.
Okay, I understand that. But I believe that once you've gotten your degree, you should be able to do whatever you want with it. Whether that's to practice medicine here, elsewhere, or not to practice at all. When you've gone to med school, you've actually been inputting in the NHS. That's what people don't realise. Medical students,
that is a fair point.
Medical students themselves on placement are doing a bit.
That is a fair
and
point.
are valued as people within the hospitals, within GP practices. I know as a med student, I did a lot. Obviously, just helping. Obviously, you're supervised, but you're still a med student in this country and you're contributing to the NHS. So let's take that point. When you've then obviously graduated...
I'll go some of the way towards you. Maybe 4 years, not 5.
When you've graduated, I feel like it's up to you what you want to do. I personally think it's good to work as a doctor in the NHS just to gauge the system. Obviously, it's a system you've trained in, a system you're very familiar with. However, I don't blame people who then say, actually, I've got my degree and I've worked very hard for it, because we are also taxpayers too. You say taxpayers, but are we not funding ourselves to go to medical school? It's not free.
It's no. You're making contributions, but the taxpayer makes a very big contribution. Final thought on this, if I may. Shouldn't we feel guilty that as a result of a shortage of doctors and people training and leaving, that we now recruit doctors from some very poor third world countries where they're probably more needed than here? Shouldn't we feel guilty about that?
Honestly, I don't think it's about feeling guilty. I think many doctors want to come and work in the NHS. As in, there are more doctors working in the NHS than ever before. Obviously, there are more leaving too, but you have to think about it. It's not just working in the NHS, it's what the UK provides. And obviously, it's a better standard of living for a number of different people who want to come and immigrate into the country. So it's not just that. And the UK needs doctors. We can't complain about doctors leaving and at the same time feel guilty about bringing doctors in.
I tell you what, I mean, if we're sending doctors to Australia and we're getting them in from Canada or whatever, fine. It's just when we sort of poor West African countries that haven't got great medical systems, that probably need their doctors and nurses more than we do. That's the point I'm making.
And I understand where you're coming from, but I feel like with West African countries or other countries, it's up to the individuals themselves, whether they want to stay and work in their own systems or come here.
Not if I was in charge, Dr. Emeka. If I was in charge, they'd be sticking around for a bit longer.